Welcome, everyone. I'm glad you're here. Quick question for you. If you're turning 65 or getting ready to leave an employer plan, have you started looking at Medicare yet? Many people think Medicare is all about comparing plans, premiums, benefits, who has the best deal. But that's actually not the real question that you should be asking. You see, Medicare isn't a plan decision, it's a structure decision. And there are really three decisions that matter, and the order that you make them can affect you for years. If you're approaching Medicare or helping someone who is, type 65 in the comments. If we haven't met yet, I'm Casey Alden. I help people navigate Medicare and design a strategy that fits their life, not only for today, but for years down the road. I'm part of a 30-year family agency, the Alden Insurance Group. We're based in Margate, Florida, and we serve clients all throughout the country. Do me a favor, tell me in the comments where you're watching from today. Another fun fact about me, I'm also a licensed pilot, and that's why so many of my clients refer to me as their Medicare co-pilot. Now, you might be asking why I'm the co-pilot and not the pilot. Well, that's because it's your journey. I'm just in the right seat sitting next to you. I'm here to help you plan the route, and then I'm here to help you avoid turbulence and bad weather all along the way. See, I see really smart, very capable people get confused about Medicare all the time. So I host these weekly live trainings to help you cut through all of the marketing noise that's out there and all the misinformation so that you can make confident Medicare choices. And let's face it, there's a lot of information out there, and a lot of it uses the word Medicare. So it's really hard to know what's real and what's marketing. So my goal with these trainings is to help you figure out exactly that. So today we're going to simplify things. There are really three decisions that matter, and that is the timing, the structure, and how you handle costs. So if you understand these three things as you start Medicare, everything else is going to become a lot clearer. If that sounds helpful, type me in the comments. So the first decision is timing. This is the one that most people don't fully understand. A lot of times people are getting ready to leave their job and they ask their HR department for advice, and HR doesn't often know. And this is not to denigrate HR professionals. They do a great job. But somebody out here might be an HR professional. But as an HR professional, your job's not to become a Medicare expert. Your job is to be an expert on your company's benefits and plans. And that's why a lot of times when people ask HR will give them kind of standard textbook advice, but Medicare's not one size fits all. And there's different factors that may apply, and that may dictate the timing. So at 65, or when you first start Medicare, that's when you're going to have the most flexibility that you'll ever have. And you can start right at 65. If you have the right kind of employer coverage, you can also delay until you're ready to retire. And as long as you have continuous coverage, you can avoid the late enrollment penalties, and you can use what's called a special enrollment period. If you're enrolling at 65, you're going to use what's called your initial enrollment period. But during these two windows, you're going to have the most flexibility that you're ever going to have when it comes to Medicare. That means no medical underwriting in many cases, and more freedom to set up your coverage exactly how you want. But I just want to warn you, this is not like all your other annual health insurance decisions where sometime in November you've got 2 weeks to pick your plan for next year and you're deciding, do I want the PPO this year? Do I want the HMO? Do I want the plan with the health savings account? And you know what? If I don't like it, I'll stick it out for a year and I'll switch. Medicare doesn't work like that, because after your initial enrollment window, things can change. And depending on your health, you may not be able to go back and do what you thought you could do. At 65 or whenever you first start Medicare, you're the one in control. Later on, it's the Medicare system and the Medicare rules that are in control. And that's why getting the structure right early, when you have the most options, really matters most. The second decision, once you've figured out the timing, whether that's at 65 during an initial enrollment period or after 65 during a special enrollment period, the next big decision is figuring out the structure. You have to have the timing right first. It's not a good idea to pick a plan and then try to figure out when you're going to retire or enroll. So once you get the timing right, we're going to look at the structure. And that's what I like to call the fork in the road. If you've been to one of my Medicare workshops, this is exactly how we explain it, because now you're choosing between two very different systems. They can look similar up front, but perform very differently down the road. And that's network-based managed care, formerly called Medicare Advantage, and freedom-based coverage, which is formerly referred to as original Medicare plus a supplemental plan to fill the gaps. Now, let me be clear. This isn't about which one is good or bad. It's about how you want your healthcare to work. So network-based plans, those are going to have a lower upfront cost. And let me explain how that works. So a network-based plan or a Medicare Advantage plan, what you're doing is you are opting out of the original Medicare system, and you're going to get your health care from a private company through typically an HMO or a PPO. That company is going to get an annual fee from Medicare to manage your care. What does that mean? Well, yes, lower upfront cost. They're not free, by the way. You've got to continue to make your Part B premiums. But with that lower upfront cost, what that means is more rules. That can mean network restrictions. Can mean you might have to get a referral before you see anyone other than your primary doctor. It will definitely mean pre-approvals for care. That's when the insurance company gets to decide whether they think a test or a treatment is medically necessary and whether or not they're going to pay for it. That's a big issue on those plans right now. It also means that these are annual plans. They're going to change every year. They can change your costs. They can change the benefits that they provide. If you're with a plan that has extra benefits like a dental plan or a vision plan or a gym membership, they can change those, or they can even remove those. And they're pay-as-you-go plans. So even though you have that low upfront cost, you're going to pay co-payments, you're going to pay co-insurance in some cases, and you're going to have to reach a maximum out of pocket before you're fully covered for that plan. What a lot of people look at is they look at the copay for their primary care and the specialist copay and think, okay, zero copay for my primary, $75 for a specialist. Oh, it's a PPO. Okay, I'm good. They don't always look below the hood and find out, well, what's the daily copay for an inpatient hospital stay? Guess what? Those can be pretty expensive sometimes. Sometimes a good average is about $500 a day for anywhere between the first 5 to 10 days. That can be pretty expensive in a hospital stay, especially if you're not expecting it. A couple $100 for an outpatient procedure like an MRI or a CAT scan, a colonoscopy, an outpatient surgery. Co-insurance, if you're undergoing chemotherapy treatments on one of these plans, you can definitely expect that you're going to pay co-insurance in the network. If it's a PPO plan, typically 20%. Of course, with an HMO, you can't go out of network. And on a PPO, if you are out of network, it can be much, much higher. The average maximum out of pocket is over $5,000 this year, and legally in the network, it can be as high as $9,250. So if you are enrolling in one of these plans, you want to make sure that you're fully comfortable with managed care and how that works. The alternative, and what so many of our clients end up choosing for their long-term coverage, is what I refer to as freedom-based care. Very simple. It's original Medicare paired with a supplemental plan that covers the gaps. I recommend this to most folks who are enrolling in Medicare, especially if you're on a fixed income, because you not only have more flexibility and much wider access to care, but you now have predictable costs and very clearly defined, very, very limited out-of-pocket costs. And when you're on a fixed income, whether that's Social Security or monthly pension payments, or you're living off of investment income or some combination thereof, your income needs to last for life. And a multi-$1,000 surprise medical bill could really put that in jeopardy. And then of course, with a medical stay, there's always those other costs that are outside of what the insurance might cover, right? Like transportation and all of those things. So with freedom-based care, you have original Medicare, you have a supplemental plan that fills the gaps, which gives you very clearly defined benefits, permanent benefits, by the way, which these plans, as long as you pay your premium, they stay in force. But you have less restrictions on care. If your doctor approves a test or a treatment, if it's one of the literally thousands of procedures that original Medicare covers, it's going to be paid for. and you can go to any doctor anywhere in the country who accepts Medicare. You'll never need a referral. You'll almost never need a pre-approval. And you can also go to any hospital because 100% of hospitals take Medicare. If you're in Florida, you know recently that Moffitt Cancer Center, which is a big cancer center down here, Moffitt Cancer Center is no longer in network with Aetna, and recently pulled out of the network with Humana. Mayo Clinic, who has a facility in Jacksonville, they don't take a lot of those Advantage plans either. So these are all things that you want to think through as you're determining which type of coverage. So getting the structure right is important because one path, yes, it's going to cost you a little more every month. It's going to give you more freedom and long-term stability. The other path is managed with lower upfront cost, but you've got trade-offs in the form of those network restrictions, the annual changes, and the pay-as-you-go exposure. And for many of the people we work with, that freedom and that predictability becomes a lot more important to them, especially as they're looking 3, 5, 10, 15 years down the road. So the third decision is really, it's kind of an outshoot of the second decision, and that's how you handle costs. This is where you really want to look at how do you want your retirement to feel financially. Not just for today, but down the road. Because again, the Medicare decisions that you make at 65 or when you first start Medicare, they're going to stay with you all throughout retirement. And a lot of times you don't notice the impact of a decision until later on. What you're really choosing is between paying more upfront for predictability and limited exposure, or paying less monthly with more exposure later. Now, there's no one size fits all, but the key is understanding the trade-off. You're not just picking a plan, so you're actually deciding how much uncertainty and how many restrictions you're going to be comfortable with. Just to give you an example, I was recently talking with a couple. They had a Medicare Advantage plan, and the husband had been diagnosed with a very, very serious pulmonary illness. They had a Medicare Advantage plan, and they were being referred to Mayo Clinic. Unfortunately, the Medicare Advantage plan was not in network for Mayo Clinic. So they were trying to figure out how they could change coverage so that he could really get the care that he needed from the specialist at Mayo Clinic. Unfortunately, by the time I had the opportunity to talk with them, he was uninsurable. It had been more than 6 months since he activated his Medicare Part B, and when you're outside of that window, you have to answer health underwriting questions. So we were looking at the different Medicare carriers that we represent, and he had to answer yes to some of the underwriting questions. That meant he was essentially uninsurable from a Medicare supplement standpoint, and that meant that he was really limited to a Medicare Advantage plan. And that's an example. And again, I'm not saying that one path is right, one path is wrong. There are people that are very, very happy with their Medicare Advantage plans, and there are certain situations where those plans can be a good fit. But this is an example of why really and truly understanding as you're starting Medicare and have all your options on the table. You've heard me talk about this on some of my past lives, is Medicare is not just a enrollment decision, it's really a strategy, and it's a key part of your overall retirement strategy. And this is where I see people get tripped up. They do it in reverse. They pick a plan first. I'm just going to sign up for that HMO. It's kind of like the one I have from work. And they don't really think about the timing or the structure. And that's how they accidentally box themselves in. When I'm flying, to use an aviation analogy, I don't just light the fires, kick the tires, and take off. I plan the route. I check the weather multiple times before departure. I've got alternates in case something goes wrong or weather pops up along the way. And so I know where I can land if something changes. Because once you're up in the air, your options are a lot more limited than they are on the ground. Medicare works. Medicare really works the same way if you think about it. So if this is helpful and you want to see how this might apply to your situation, or maybe a friend or a loved one that you're helping is trying to figure it out, my team and I, your Medicare flight crew, if you will, we'd be honored to help you. You can book an appointment by going to medicarequotes.com/Facebook. Just enter your information and your callback number and pick a time and we'll get back to you. You can call the office at 954-970-4760 and Liz or Christine will help you get on the schedule or connect you with one of us for free. Or you can just comment guide in the comments and I'll reach out to you personally and we'll figure it out from there. So here's a few common questions that I get as I'm talking to people. The first one that I get is, can I just switch later if I don't like my plan? Sometimes you can, but not always. Thinking back to that couple that I mentioned, they thought that, and unfortunately, because of health changes, they weren't able to pass underwriting. So yes, you can, but you have to be able to answer that company's health underwriting questions. But the other thing to keep in mind too is if you wait a couple years, your premium is going to be higher in many states because you're going to be a few years older. So that's a factor too. Do I have to do this right at 65? No, not always. But the timing affects your options. And some things that you want to consider too is especially if you're staying on a group plan, you really want to look at your group coverage and possible coverage with Medicare's side by side. A lot of group plans are also network-based managed care plans. So in a lot of cases, people don't realize this, but they can keep working and they can switch their health insurance to Medicare and they can actually have better coverage for the same or sometimes even less than what they're paying. But again, that's not every situation. Some group plans are really, really good and the employers do a great job of picking up a lot of the costs. And in that case, it might cost you to switch to Medicare. And that's an example of where working with somebody who really knows the system but's also going to take the time to get to know you, your situation, and your needs can help you put together the right strategy. Sometimes that strategy involves enrolling at age 65. Sometimes it involves delaying. Why are those zero premium plans so popular? That's a question I get all the time. Well, lower upfront cost. And this is what you see advertised all the time. If you see Joe Namath, William Shatner, or Kelsey Grammer on TV, they're almost always advertising these plans. And they make it almost sound like it's an official announcement from Medicare. They'll talk about like, oh, he's missing 20%, or you could be missing out on benefits that you're entitled to. You need to act now. Time is running out. And they make it sound very official. But those are advertisements. And I see so many people, because it's a celebrity you're familiar with, that's why they use the celebrities in the commercials. They have credibility with an audience. So many people see those ads, and because they mention Medicare, it sounds and feels official. And it sounds really, really good. No premium, extra benefits. But those plans do come with structure and trade-offs, and most people don't learn about that structure and those trade-offs until later on. Now, if you know all about it up front and you're getting into it because you made that conscious decision and you knew exactly what you're getting into and how it's going to work, that's a completely different story, and that means one of those plans might be right for you. But it's important to really understand your choices up front. And that's where working with a trusted guide, somebody who does this all the time, can really help you figure out what strategy is going to be right for you. So Medicare is really not that complicated once you understand how the systems work, but it's layered. And if you understand the structure now, you're going to avoid a lot of the problems that people run into later. If you'd like to talk to someone about your situation, you can go to medicarequotes.com/Facebook. You can book an appointment or have us call you back. You can always call the office, 954-970-4760, or just type guide in the comments and I'll be glad to walk you through it. Thanks again for being here, and I will see you next week at 3 p.m. Eastern Time for another edition of Medicare Live. Take care, everybody.